Along with the surge in COVID-19 cases in India, there have been numerous reported cases of mucormycosis in Gujarat and Maharashtra. In Surat-based Kiran Super Multi-Speciality Hospital, 7 out of 50 mucormycosis patients being treated there lost eyesight. In Maharashtra, at least 8 COVID survivors died due to mucormycosis, while 200 others are being treated. These patients survived COVID, but the fungal infection attacked their weakened immune system. The central government has issued an advisory on the management of mucormycosis, a fungal infection among corona patients. As noted in the advisory, the infection may turn fatal if uncared for. This fungal infection mainly affects people who are on medication that reduces their ability to fight environmental pathogens. It is being found in COVID-19 patients with uncontrolled diabetes and prolonged ICU stay. What is mucormycosis? Mucormycosis is a black fungus infection that is being detected lately in some COVID-19 patients in India, who have had prolonged stays in the ICU. Due to this infection, few COVID survivors have lost their vision. It is a serious but rare fungal infection, which is caused by a fungus named mucor, which is found on wet surfaces. These fungi generally live in the environment, particularly in soil and in decaying organic matter, such as compost piles, leaves or rotten wood or even decaying fruits and vegetables. According to health experts, it is found in the soil and air and even in the nose and mucus of healthy people. Mucormycosis mainly affects people who have health problems, or take medicines that lower the body's ability to fight germs and sickness. It most commonly affects the sinuses or lungs, after inhaling fungal spores from air. It can also occur on the skin after a cut, burn or other type of similar injury. How does mucormycosis affect the human body? This fungal infection affects the sinuses, brain, and lungs of a person, and can be life-threatening to individuals who are diabetic, or cancer patients, or people with HIV/AIDS. In some cases, the patients lost their vision in both eyes, and in rare cases, the doctors were forced to remove certain body parts, like the eye or jawbone, to stop the disease from spreading. Most of the patients who were found to be suffering from the fungal infection are diabetic patients. What are the symptoms of mucormycosis? According to the center's advisory, people need to watch out for pain and redness around the eyes or nose, one-sided facial swelling, headache, blurred or doubled vision with pain, fever, coughing, chest pain, worsening of respiratory symptoms, bloody vomits, shortness of breath, altered mental status, toothache, and loosening of teeth and jaw involvement. How severe is mucormycosis? Mucormycosis has an overall mortality rate of 50%. What triggers mucormycosis in COVID-19 patients? According to doctors, the mucormycosis infections may possibly be triggered due to the use of steroids, which is currently seen as a life-saving treatment for critical COVID-19 patients. Administration of steroids reportedly reduces inflammation in the lungs of the critically ill COVID-19 patients, thereby helping in stabilizing their oxygen levels. However, steroids also reduce immunity and lead to a spike in blood sugar levels, in both diabetics and non-diabetic COVID-19 patients. This drop in immunity is said to trigger mucormycosis among some of the COVID patients, especially when they are exposed to wet surfaces. NITI Aayog member VK Paul said that most life-saving drugs that are currently being used to treat COVID-19 patients suppress the immune system, and this is when the fungus attacks. He said that even medicines like tocilizumab and itolizumab suppresses the immune system and lead to mucormycosis in diabetic patients. According to Dr. Tatirao Lan, head of Directorate of Medical Education and Research of Maharashtra, in such situations, the fungus infects the patient easily. If it reaches the brain, it can prove fatal. In one such case, one eye of a patient had to be removed permanently to save his life. When a COVID-19 patient, who has been administered these life-saving drugs, is put on oxygen support, which has a humidifier containing water, the chances of him or her getting the fungal infection increase. Should people be alarmed? NITI Aayog member VK Paul confirmed that there is no big outbreak of the fungal infection. The situation is being monitored and the treatment for mucormycosis is available. However, a rising number of cases of infection have been reported, especially among young people, or people with uncontrolled sugar levels. Is there any way to prevent mucormycosis? According to doctors, the only way to prevent the fungal infection is to make sure that the COVID-19 patients are being administered the right dose and duration of steroids. Also, a constant check and care is required of the patient's sugar levels after their discharge. The advisory issued by ICMR has listed certain do's and don'ts. To prevent yourself being infected with mucormycosis, you need to control hyperglycemia, monitor blood glucose level post-COVID discharge, and also in diabetes. Use steroid judiciously, ensuring correct timing, dose, and duration. Use clean, sterile water for humidifiers during oxygen therapy. Use antibiotics and antifungals judiciously. And last but not the least, do not miss warning signs and symptoms. Stay safe and take care.